Hey guys, how are you? Week 2 summary, Immunology 101. Let's go over the hypersensitivity reactions and their examples. There are 4 types of hypersensitivity reaction, A, B, C, D. The first A, B, C are antibody-based. The first one is allergy, type 1 allergic response. Best case scenario, you're going to have runny nose or hives, which another name for which is urticaria, when being exposed to pollen or, and you'd be surprised, latex gloves. Worst case scenario, you might have anaphylaxis, which is a severe and life-threatening type 1 allergic reaction. So what's the solution? When you start working, request non-latex gloves. Just remember that 10% of all the healthcare practitioners develop latex allergy at some point of their life. All right, type 2, so this is allergy, anaphylaxis. B is anti-blood cell antibodies. Examples for this would be erythroblastosis fetalis and ABO incompatibility. All right, so we went over ABO very much in detail in class. Let's talk about erythroblastosis fetalis once again. Please remember that another name for it is Rh hemolytic disease of the newborn. Hemolytic disease of the newborn or erythroblastosis fetalis. What happens here is that we have the so-called D antigen, which is present on the surface of the red blood cells. And basically, we just say cells that have the D antigen are a part of the Rh blood group. All right, so you can be either positive or you can be negative for this D antigen. If an Rh negative mother, she doesn't have this D antigen, sees her baby's blood and the baby is Rh positive, that means baby has RBCs with D antigens. Okay, then the mother starts making antibodies. Antigen is an antibody generator to her Rh positive baby's RBCs. All right, so mother's anti-Rh antibodies then attack and destroy its baby's RBCs because mom thinks they're invaders. Now, obviously, mom can thus kill the baby, and I told you the first child does not get affected by this most of the time. It's the second child because you actually need to ensure that mother gets sufficient exposure to the Rh antigen. So how do you prevent this? You give the mother a medication called ROGAM, which protects the Rh positive fetus because it kills all of the very few red blood cells that are Rh positive, baby's red blood cells that get into mother's circulation. And so there is not sufficient time to make antibodies in mom's blood. So you got to give it before and after delivery, and this makes the second kid safe. Type 3 so that was type 2 hypersensitivity. Type 3 hypersensitivity, examples for it would be systemic lupus erythematosus, type 3 hypersensitivity, and rheumatoid arthritis. Obviously, both of these are autoimmune diseases, right? So autoimmune diseases, and what we see here in systemic lupus erythematosus is a so-called butterfly red rash on the cheeks and the nose, on the face, but also muscle and joint pain with occasional fever because it's an autoimmune response, right? So what we see here is antibodies against body's own cells. In rheumatoid arthritis, it's something similar. We have joint swelling on fingers and wrists, and this is a chronic joint inflammation that is symmetrical because antibodies know no right and no left. They're just swimming there in blood. Whenever they see an antigen that they were made against, they just bind to it, precipitate, and cause an inflammation. This is type 3 hypersensitivity reaction, SLE and RA, rheumatoid arthritis. Type 4 hypersensitivity reaction is the only one, the D in the ABCD, the D stands for delayed. Delayed hypersensitivity reaction happens without the involvement of antibodies. What we have here is the cytotoxic T cells, cytotoxic, toxic to cells, cytotoxic CD8 positive T cells, directly killing cells that the body thinks are foreign or harmful. What we have here, for an example, is a contact dermatitis due to, for example, poison ivy, poison oak, poison sumac. They might tell you anything. But here we have an allergic reaction to oily resins produced by, this plant. All right. Now, believe it or not, Candida is a fungus. And we know that it causes oral and genital thrush, but Candida may also be a cause for type 4 hypersensitivity. While we're talking about T cells, let me include a brief summary of two diseases where there is a T cell deficiency, all right? So T cell deficiency can be seen due to a lack of thymus development. I told you in class, T cells are made in the bone marrow just like all other blood cells, and then they migrate to the thymus and undergo education. If there is aplasia, that means no formation of thymus, or hypoplasia of thymus, what happens is that the T cell development is lacking or absent. And when we have it due to thymic aplasia, we call that syndrome DiGeorge syndrome, absence of T cell development, T cell deficiency. All right. The second disease is something that you've definitely heard about or read about. It's called AIDS, acquired immune deficiency syndrome. The virus that causes AIDS is called HIV, human immunodeficiency virus. With a name like that, it's obviously very clear that something is deficient. Well, I'm telling you, it's the T helper cells, CD4 positive. You studied this in your micro and your anatomy, I know for sure. So CD4 positive helper T cells that are deficient. How does that happen? Well, there is an infection. A patient gets an infection, and right away, patient presents with flu-like symptoms. Now, flu-like symptoms happen very often, 2 to 3 times a year. An average adult experiences, a runny nose, and so flu-like symptoms are not a big deal. And if the patient does not get treated after flu-like symptoms, that does not get diagnosed and does not get treated, what happens is something very normal. Symptoms just disappear, and if that patient still is not treated, still is not diagnosed, then within a certain time, a very severe deficiency of the immune system happens in that patient, is seen in that patient. We call that immunodeficiency, acquired immune deficiency syndrome, and that's because of decrease in CD4 positive helper T cells, AIDS.